Hello, everyone. I'm Dr. Sienna Miller. I'm a naturopathic physician specializing in integrative dermatology. Today, I'm going to be going through the GI-MAP Stool Analysis, which is a comprehensive stool test by a company called Diagnostic Solutions. This is not a sponsored video. This is just a test that I run all the time and I find incredibly helpful for digestive disease and also skin conditions. I have probably run this test on about 75 to 100 patients at this point, at least. That's just a general ballpark. I also recently completed Dr. Julie Greenberg's root cause dermatology professionals course, and she runs this test on all of her patients. So I've had a lot of experience, learning about studying the results and going through them with patients and prescribing treatment plans based on the results. So today I'm just going to be going through their sample report, and as I would with a patient, this is really in the context of skin disease. So that's sort of how I'm approaching it, and I'm just going to give a very general overview and kind of a basic approach I would take for treatment. If you're interested in having one of these run for you, I recommend scheduling an appointment with me or another qualified health professional who has experience with this test and knows how to interpret and treat based on the results. So next, I'm going to be sharing my screen here, and I'll be going through the results. All right, here we have a GI-MAP stool analysis. This is what it looks like. And just a reminder, this is a DNA PCR stool analysis, and it's done via an automated process. It's looking for DNA in the stool, so it's a very sensitive test, which is why I really like it. But just note, different stool tests, the technology is different for how they are looking for the different results in pathogens, since some are culture based, some are DNA based. There's other technologies too. So looking at different stool tests, you can't really always compare apples to apples. Sometimes it's a culture based off of this, or a biopsy. It's really apples to oranges. You cannot directly compare them all the time. So I just wanted to make a note on that this is a DNA test. So page 1 here, this is the pathogens page. So I honestly don't see this page come back very often for my skin patients. This would be more in the context of acute gastroenteritis, like food poisoning, or drinking some contaminated stream water, getting giardia, something like that. So usually this doesn't pop up unless somebody has acute gastrointestinal illness. In that case, you'll want to address the concern, or you'll want to treat based on their digestive symptoms, and whatever comes back positive, like if they have C. diff or giardia or whatnot, you'll want to look up up-to-date guidelines for treatment and what is recommended based on their clinical symptoms and the results here. But in most cases for skin disease, I don't see this page come back as anything positive, but you want to take a look at it anyway. Next page here is Hpylori. This is the next section. So Hpylori is a bacteria that hangs out primarily in the stomach, and why we don't like Hpylori is because it lowers the stomach acid to allow itself to survive better. What that also does is allow other microbes and pathogens to survive. Our stomach acid not only, it serves a lot of purposes. It not only helps with digestion and tightening the lower esophageal sphincter, but it also provides sterility. We're eating so many microbes and contaminants on our food all day long, on fingers, different products, things we encounter. And so we really need that stomach acid as kind of a first line of defense to fight off any potential pathogen. So with the stomach acid lower, it not only, allows H. pylori to survive, but other potential pathogens. So this is why I really pay attention to this. I don't like this to be present at all. So in chronic skin disease, I want this to be 0, not showing up. If it is showing up at all, we definitely want to treat it at some point, either right away or later on in treatment, just because it can hinder success with other treatments, like I said, by lowering the stomach acid. Also, full-blown H. pylori infections can contribute to gastric ulcers, and if left untreated for a long time, it can lead to even gastric cancer. So this is something we don't want to ignore. So that is section 1. I usually treat this unless it's a full-blown infection. If they have characteristic digestive symptoms, I would probably order a breath test or endoscopy with biopsy if this comes back really high and they have symptoms, and just, see how severe that H. pylori infection is. If it's just hanging out in the stomach, and even if it is an infection, I usually like to treat with herbal antimicrobials. There's certain, and not even antimicrobials, there's other herbs that are helpful as well, and supplements that are not herbs. But I like to treat naturally if possible, depending on the severity, just because, there's a lot of resistance with both conventional and naturopathic therapies. And I have found like the supplements that I use to be quite effective, so I know that they work. Also, the conventional treatment for H. pylori is quite intense. It includes like 3 antibiotics and a proton pump inhibitor all at the same time, and it's just very harsh on the system. So I like to try to treat with herbs first, but you need to definitely take the case and just see what their digestive symptoms are looking like as well. Like if they have an ulcer or anything like that, you may need to use higher force intervention for that. All right, moving on. The next section here is commensal bacteria. So this is, your microbiome. This is what we really think about when we're talking about the microbiome. These are beneficial bacteria that we want to be present, at adequate levels, but also not too high of levels, because it can cause symptoms and things like SIBO. So in this section here, they pick out a few specific species that are notable. And then they really just take a zoom out approach over here and just look at the phyla, so kind of the families, because they're not going to look at all the millions of different species. So in this section, I really just look at the overall theme. Like overall, are they really, really low? Overall, is there a lot of overgrowth? And then taking a look at the families, like is there overgrowth? Are they low? This patient kind of looks like they're all over the board. They have some levels are low, some levels are a little bit high. And then these two specifically, Akkermansia and Faecalibacterium, if these are low, that is a sign of possible leaky gut and disrupted gut mucosal barrier. These two promote mucin production in the gut, which is a thick mucus layer above your GI, your epithelial cells in your gut. Is very protective of your gut lining. So if these guys are low, that's kind of one of the telltale signs of chronic inflammation and potential leaky gut and the need for mucosal barrier support. So if these are really low, we want to make sure, sometimes I'll use probiotics, and the strain is dependent on what we see here, and sometimes the skin condition. Other ways to support healthy levels are probiotic-rich foods. I usually recommend against kombucha because that has brewer's yeast, but everything else, is helpful. And then feeding these guys with lots of fiber in terms of plants. So vegetables, beans, legumes, nuts, seeds, herbs, and spices, and fruit are what you want to focus on, and getting a diversity, like a wide diversity of those things, and making sure you're getting enough every day. I like to recommend 30 grams every day of fiber and 30 different plants every week. And with overgrowth, we'll address those with herbal antimicrobials usually. So moving on to the next section. This is the opportunistic microbes. So this entails some bacteria. They go over fungus, yeast, viruses, and then also parasites, so protozoa and worms. These are all things that, are not necessarily pathogens, and they can be present in the gut and not necessarily an issue until they start to overgrow and overcolonize and kind of take over the land. I guess I'll use that metaphor. Take over the land in your gut where we want to have the beneficial bacteria. That's when they can start to cause issues, digestive symptoms, inflammation, leaky gut, and that can really be reflected onto the skin. So this page is interesting. I'll just go through and make note of some of the different species that are high. And it's really cool, like with different skin conditions, whether it's acne, eczema, psoriasis, we're really starting to see general themes of certain microbes that are high with various skin disease. So it's really cool to see those patterns. So just going to take a note, Pseudomonas, that can be a problem. Definitely Citrobacter, Klebsiella. These two are, Klebsiella is really common with acne, I see. And then, and we'll want to pick specific herbs, herbal antimicrobials that are going to make sure we target all of the different species that are high. And they sort of line it out like certain ones are more inflammatory than others and may trigger your immune system. So they kind of lay it out that way, which is really helpful. Yeah, and this will pick up on yeast. This test, it's hard. I have found it's hard to pick up on yeast in the stool. So my takeaway that is, even if the yeast section is negative, that doesn't mean there's not yeast present. Sometimes I'll do a candida immune complex in the blood work. Also, this is why I run an organic acids test on my patients too, because that's better at picking out like different molds and candida. So, take this section with a grain of salt for sure. If it comes back present or positive at all in this section of the test, I make sure to treat for yeast overgrowth. Viruses, I don't think I've ever seen viruses come back for skin disease, which is probably a good thing, but that's what that section would show. Every once in a while, I'll get some protozoa popping up, but this person doesn't look like they have it. And then if those pop up, I'll use herbal antiparasitics, unless it's like really high. Always check with any of these things, like always check like standard of care guidelines just to like make sure you're not missing something. Like if one of these came back and it was like absolutely required to treat with a pharmaceutical, I would do that. But in most cases, these are kind of usually low level presence of these things. So I'll just use a herbal antiparasitic blend when they do work really well. Okay. Last section here is intestinal health markers. So we have here, this is markers of digestion. So steatocrit, which is fecal fat. This person's looking pretty good. We don't want fecal fat to be high in the stool. That would tell us about malabsorption, maldigestion of fats, and probably other things as well. If this comes back low, I'd want to do some investigation as to why that is. Make sure like liver, gallbladder, pancreas, stomach acid, like make sure everything, what are the other symptoms that could indicate there's a problem with one of those organs. H. pylori can sometimes cause this to be high. Oh, H. pylori also can cause pancreatic elastase to be low too. I see that quite often. And if it makes sense with their digestive symptoms, I'll sometimes put a digestive enzyme on board if either of these are abnormal. Next here we have beta-glucuronidase. This is produced by, in the gut, it's produced by bacteria, and this can interfere with your body's glucuronidation, which is a mechanism that your body uses to get rid of waste and toxins in the body. And so if this is really high, I often see, issues with detox and metabolism. Like a good example is menstrual symptoms. So like heavy bleeding, painful cramps, PMS, like signs of estrogen dominance. Sometimes this will be quite high because that can interfere with estrogen detox and cause the estrogen waste to be reabsorbed in the body. So I'll see estrogen dominance a lot going hand in hand with this and just digestive symptoms in general. So treating overgrowth is going to help that if it's high. Also, I'll give some things that can help interfere with beta-glucuronidase if there are symptoms to match it. So that's something to take note of. Blood, it's pretty self-explanatory. If there's blood, definitely wanting to ask more questions about that. If they're seeing blood in the stool, usually I'll refer to GI or like their primary care to have workup of that, because I'm just seeing if I'm seeing just them for dermatology, I'll refer to someone else. Otherwise, I'll order a little bit more workup for that. Next is markers of your immune response. So secretory IgA. Secretory IgA is part of your mucosal immune system. So this is present like in the guts, in the sinuses, in the vaginal canal, things like that. And it's a first line of defense before pathogens get absorbed into the bloodstream. So, I'm kind of looking for multiple themes here. With skin disease, I'll either see it really, really high, which is a sign of inflammation. On the other hand, I'll see it really low and depleted, which tells me there's such chronic inflammation that your body is no longer successfully mounting that immune response, which is a telltale sign of leaky gut. So if this is really low, even if it's high too, but especially if it's low, we'll want to do some counseling on, just anti-inflammatory diet, making sure they're avoiding things that can disrupt the gut mucosal barrier and cause inflammation. And then treating overgrowth is helpful for this as well, like the pathogen overgrowth. And we'll also want to do some good gut healing formulas and protocols with this if it's really low. Antigliadin IgA, this is an immune system reaction marker to gluten. So if I see this is really, really high, sometimes I'll be screening for celiac disease. Other times I'll just, if they don't have celiac, but this is high, I'll recommend gluten elimination, which can often be quite helpful if that's really high. EPX here is just another inflammation marker. I honestly never really see this high, but just, if it's high, it tells us there's inflammation going on. Almost done here. Hang in there with me. This is calprotectin. So, if this is like moderate to like a little bit high on here, I do see that with just general inflammation. If it's like moderately elevated, I'll usually just repeat it in like a month or two. If I see it really, really high, like I recently had a test over 2,000, that can be a sign of inflammatory bowel disease. So like ulcerative colitis or Crohn's disease. So definitely wanting to refer to gastroenterology if this is high. Honestly, if it's elevated at all, probably above the 173, I would, be confirming with like a LabCorp or like another external lab test just to confirm, and then probably referring to gastroenterology for that. These are add-on tests that I don't usually run, but I'll just mention them. Stool gluten peptide. So this is high. This tells us about, how much gluten probably bothers your gut. I don't know. I never run this one. And then zonulin is a leaky gut marker. But honestly, I don't feel like it's worth it to add this one on just because we get some other signs of leaky gut, in other parts of the stool test. All right, that was my overview of the GI-MAP as I would go through it with one of my skin patients. I hope you found it helpful. If you're interested in having this run on you, or you think, it might be really helpful, contact a qualified healthcare professional. I'm seeing patients for this and ordering it for people. So you can, check out my information down below if you'd like to schedule with me to have this run and go over it. But anyway, leave any comments down below if you have any questions or any other videos you'd like to see. I think I'm going to do a series going through the GI-MAP of various skin conditions, different patient stool tests, HIPAA compliant, of course, and with consent, but it's just something I'm thinking about doing. I think it'd be very interesting. Anyway, if you enjoyed this video, please give it a like, follow my channel for more related integrative dermatology content, and I will see you in my next video. Bye.